Collier. Good morning.
Good morning, Rickey, Smiley, and morning crew. We're going to talk about should you be wearing a mask for coronavirus.
Okay.
All right, so now we are up to about 140,000 cases, and it's thought that actually for every case that's been diagnosed, it could be 10 to 20 additional cases. So the count, as I stated before, that count is kind of artificial because we're not doing testing, so we don't know what the numbers are. But what we do know, and the absolute correct number, is the death rate. That's the number of people that have died from COVID. So that's up to 2,400 now, and so that's where we are. So now that this pandemic is growing and going on, experts have started to question the official guidance about whether ordinary healthy people should protect themselves with a regular surgical mask or even a scarf around their face. So we've had a surge of infections in the United States, and that's put the country at risk and the epicenter now for this epidemic. There are more confirmed cases, of course, in the U.S. now. We're exceeding China and Italy, and so that's a problem. So there was a study conducted, Rickey, that when researchers evaluated the previous SARS outbreak in 2003, they found that hand washing, again, was 10 times more effective than any other technique. It stopped 55% of transmission. But when wearing a mask, that increased to 68%. So there was a higher, actually, protective factor from wearing a mask. And if you wore a mask and gloves and washed your hands up to 10 times a day, then that gave you the greatest level of protection, up to 91%. So now the question is, now should people be wearing masks? And so if you have access to a mask, that there are people actually that are wearing these masks incorrectly, and that's why I want to clear this myth up right now. Okay, masks have two sides. There's usually a white side, and then there's a side with color that's usually blue or yellow. Now, when you wear the colored side out, that's what you do when you are sick to prevent from infecting others. But if you're trying to protect yourself from infection, you wear the white side out, and that's the filter side. That's to protect the germs from getting in and infecting you. So when you see all these people walking around with the blue side out, then it's probably being worn inappropriately. So again, white side out, when you're trying to prevent from getting infected, and the colored side out when you are already sick and you're trying to prevent infecting others. But when you look at all these pictures of people wearing masks, they're doing just the opposite. Most of the people are wearing the colored side out, and that's not giving them that's not protecting them the way that they're trying to be protected. So if you can have access to a mask, if you have some, next time you go to the nail shop, ask Home Child to give you an extra mask because they have them.
Don't do that, Dr. Collier. Don't do that. Don't do that. Don't do that.
So
go to Brass nail shop and get an extra mask.
You, Dr. Collier, no.
Dr. Collier, I have a question.
Hold on.
Yes.
Go ahead and ask a question, and he's going to answer it on the other side. Go ahead, Eva.
What do you do when those mats get so hot? It's hot under there, but you got to keep it on, but it's hot.
Y'all, Rickey Smiley Morning Show. We got Dr. MJ Collier on. It's 23 minutes after the hour, y'all. After the hour, Eva was asking about the mask being too hot, and a lot of people are uncomfortable.
Kind of uncomfortable. Yeah.
Go ahead, Eva.
If you practice what medical guidelines and you're telling us, then we're supposed to wear this mask, like if we go out to the grocery stores or other places that are essential places, just to make sure that we do not contract the infection. But the masks, to be completely honest, they're uncomfortable. They're hot. Even if I brush my teeth and gargle a lot, it's still hot up under there. So what can we do to make the masks a little bit more comfortable, considering that we really need to wear them?
Okay, I'm so glad that you mentioned oral hygiene. Definitely need to brush your teeth, and because your breath is warm, it's 98.6 degrees, and just breathing in and out, you quickly become aware of what's going on. But brushing your teeth, gargling, of course, with a solution of, I like Listerine solution as best, but something that feels cool, like a Mentos mint or something, can give you some relief. Having to wear these masks all day, believe me, they are unpleasant. That warmth on your face, I have to cut short, I guess, interviewing the patients because it can become unpleasant, and I'm really in a hurry to get back to my office so I can take that mask off. So again, so that is a key point. I had a patient that tested positive, and they didn't want to wear the mask at night because they couldn't sleep in it because it made their face too hot,
right.
And so they didn't wear the mask, and the wife ended up getting infected. So and she's having worse disease.
So they were sleeping in the same bed?
Well, that's, we already talked about that you should be social distancing, and she should have been in another room.
Right.
But, doing what most good wives would do, she was taking care of her husband, and so subsequently became infected. So once again, this is real because you can't see it. You can't be shy about it. So the official guidance continues to recommend that masks should be reserved for people who are already sick. Healthcare workers and caregivers who must interact with infected individuals on a regular basis. So that is where we are with that. That's why the World Health Organization, the CDC, recommend that people already infected wear the mask to protect others who may come in contact with them, because the objective is to prevent them from spewing out the viral infected particles. So, again, we're recommending that, again, if you are a necessary worker and you cannot avoid public transportation, that's one of the issues that they're having in New York right now. A lot of people take the underground transit to get to work back and forth. And so they need to be protected because they cannot avoid and they cannot socially distance in that transportation modality. So once again, if you have access to a mask, you want to wear the colored side out. If you are already sick, to prevent from infecting others. But if you know that you are sick, even if you have not tested positive and you have a presumptive diagnosis, you don't need to be out anyway. You need to be wearing that mask to protect the people in your home. And then if you're out to protect yourself, the white side out, you make sure you're wearing the white side out. That gives you some relief because the filter is on that side, and so it doesn't trap your breath the way that it does when you wear the white side in. But it still, over time, becomes a bit warm and oppressive if you're wearing a mask like that.
Hey, Dr. Collier, stop me if I'm incorrect on anything I say.
Okay.
They are running out of Lysol. They're running out of Clorox wipes. Now, tell me if I'm wrong. What I did was I got some spray bottles off of Amazon, and I made up my own Clorox Water, and I spray it, and I take the Kleenex towels. Kleenex has towels that's tougher than paper towels. I spray the Clorox Water on those Kleenex towels, and I do all of the doorknobs, the door handles, the steering wheel, whatever. And sometimes I just spray it on in the air conditioning intake vent or whatever, just to get anything that'll just circulate, that'll kill germs, wipe off all the counters. And you know what? I've been a kind of germaphobe for years anyway, just always kept everything Clorox wiped down. But instead of going through all of the Clorox wipes that I have, I just kind of made some Clorox water. What am I doing right?
That's absolutely correct, Ricky. And I would tell people, go and buy those big gallon bottles of the Clorox. That was one thing that I found was empty on the shelf the last time I went to the store to purchase some cleaning items. There was one bottle of Clorox left, and there was a gentleman there, and so I made sure that he got it because I still had some. I was just trying to make sure I didn't run out. So, but he got the last bottle. But, things are in short supply, but you got to stay on top of when these trucks are making deliveries on Monday morning and Wednesday mornings. And so you can get in there before lunchtime, and you probably will be able to get what you need. But guess what, Ricky? You don't have to, again, Clorox, the most effective, bar none. But you can get Clorox wipes, the wet wipes, anything that says that it kills 99% of germs. There may be some no-name products that you can get that will do that for you. But if you don't have access to any of that, you just take some regular dishwashing soap and put it in 8 ounces of water. You put about 10 drops. It doesn't take a lot. And that is a good cleaning solution. It doesn't kill everything. It doesn't kill fungi. It doesn't kill some bacteria, but it does kill the coronavirus because of the saponification. Soap is very effective at killing viruses. Yeah, any of them, Dove, any of them would be good. So, and it takes a small amount. You don't have to make a 50-50 solution or anything like that. About 10 drops in 8 ounces of water, that's a full glass, will be sufficient to do. And so, but again,
what about Pine Sol, Dr. Collier?
Oh, Pine Sol is good. Pine Sol is good. And again, but read that label and say what it says about germ killing. And you want it to say it kills 99% of germs because some things they smell good, they look good, and they oil up, your surfaces, but they don't do a good job of, and they're not good antibacterials. So let's go over what are high touch surfaces then. You talked about countertops. Let's think about doorknobs, light switches, or things that oftentimes are ignored. The door handle to the refrigerator and the microwave are oftentimes things that are ignored. Drawer pulls and knobs on your dressers and drawers, those are oftentimes ignored. TV remote is the most infected item in your home without question. And then and you should clean your cell phone. You should clean your cell phone. Any of those solutions will work good. Now, they're not recommending that you put certain things on your cell phone. So I know that there are instructions on the internet about how to clean your cell phone. They recommend you do that a minimum of 2 times per day. and because that's the one item that's always in our face, and we're always using it, and we'll sit it down, and people can't cough in the air, and it can collect those infected droplets. Exactly. So, and one thing you could do, put that TV remote inside a baggie bag. You can still see it. You can still work all the numbers, and that will protect it from anybody in the house.
All the time.
All the time. All right. So,
especially in hotels.
Or you can use saran wrap.
Yeah,
wrap it up in some saran wrap
as well. Okay, Eve is just the Martha Stewart of how to keep things clean. I love her for that. Okay, but faucet handles and toilet handles. Again, wash your hands before you do cleaning and wash your hands after you do cleaning. Now, the question is, people say, do I need to wear gloves? Gloves are recommended for home cleaning, particularly with some of the chemicals that you may use. But wash the gloves after you use them, particularly if you plan to reuse them. Use separate gloves for the bathroom and toilet than you do for the kitchen counters, etc. When you're done cleaning, you wash the gloves with soap and water, you dry them, you put them off, and you store them. You don't lay them down on any countertop or surface. You store them away. And then that's about all you can do. But when you get home, and that's the other thing. You don't want to bring the virus into the house. And one of the recommendations now that I'm seeing is take off your shoes. Hang up the garments, the outer garments that you have, and if you can, wash your hands for 30 seconds with soap and water, not just 20, and try to improve things that way. So we're getting through it, Ricky. We're learning a lot on a day-to-day basis. But remember about those masks. Remember about those masks. The white side out to prevent you from getting infected. The color side out, which is usually blue or yellow, to protect other people from being infected by you.
So real quick, Dr. Collier, if anybody, if there's any seamstress out there, what kind of material or fabric that they should use in order to make the mask, the ones that's out there making them?
Okay, they are making the mask, and again, any fabric that you get is not going to have the filterability of a surgical mask, but any barrier. It can be a cloth. It can be a scarf around your nose and mouth. Anything, any kind of barrier. So, any kind of fabric. They want to use, a cotton with a tight weave, just like your sheets can have a certain thread count to them. You want to use a high thread count, but something that you can breathe through, so that it doesn't become so unpleasant that you won't wear it. And so that's what So various fabric, silk would be good, but a cotton blend would be good because it's breathable. But they're coming up with all kind of innovative things in reference to making masks at home. And so I really, really am glad to see some of the things I see on the internet about making masks.
There it is, Dr. Collier. Let everybody know how you can be reached.
Okay, I'm going to keep it short and simple. Go to Instagram. Follow me on Instagram at Ask Dr. MJ. And I posted several videos this weekend. And again, I'm interacting with people on the internet. Ask Dr. MJ on Instagram. Or go to my website, lipodrops.com, for informational supplements that can boost your immune system.